Welcome to the Capstone College of Nursing Clinical Practice Lab and Simulation Center for Clinical Excellence. The mission of the Capstone College of Nursing is to promote the health and well-being of the people of the state of Alabama, the nation, and the world through nursing education, research, scholarship, and service. Our labs are integral to meeting the college's goal of providing high-quality nursing education. The Clinical Practice Lab is where our students learn the skills fundamental to providing good patient-centered care and practice them until they become second nature. The Simulation Center is where they practice their patient care skills while developing confidence in their ability to handle complex clinical scenarios. Students use the Clinical Practice Lab during first semester of upper division to learn physical assessment skills, and during second semester to learn fundamental nursing skills. The open floor plan allows students to learn collectively as well as practice within their small clinical groups. Multiple monitors and cameras throughout the lab provide students the ability to view instruction from any location in the space. Over 30 Stryker hospital beds, Hospira Plum A and Alaris Smart IV pumps, and task trainers give students hands-on experience with equipment in a simulated hospital environment. Students use the Clinical Practice Lab's low-fidelity simulators to practice inserting IVs, assessing vital signs, bathing patients, dressing wounds, administering medications, providing central line care, and other hands-on basic care skills. The hands-on skills learned and developed in the Clinical Practice Lab form the foundation of our students' clinical experience and will serve them throughout their nursing careers. One of our goals in the Capstone College of Nursing is to allow students to develop their autonomy to be safe, competent nurses. In clinical settings, patient needs are the priority. When students care for unstable patients in these clinical situations, they often assume observational roles so that the emergent needs of the patient can be addressed by the healthcare team. In simulation, we provide our students the ability to take charge in these complex patient scenarios. Students practice on high-fidelity human patient simulators throughout their upper division nursing courses, beginning with basic assessment in the first semester and culminating with highly complex scenarios in their final semester, putting all the knowledge and analytical skills they've gained in the program to the test. We use low-fidelity mannequins to provide students the opportunity to practice additional skills. Furthermore, faculty are able to use these mannequins in the classrooms to provide hands-on learning for students. Simulation supplements clinical experience, allowing all of our students to be exposed to scenarios in the Simulation Center that they may miss otherwise, and allows us to deliver consistent, focused experiences to all of our students. 4 central rooms house our adult patient simulators, with 2 additional rooms for our pediatric and maternity simulators. All rooms also have a vital sign monitor. From the centrally located control rooms, faculty members can observe the simulations while using sophisticated software to control the mannequins and respond to student actions and interventions. Students work in teams and assume the roles of charge nurse, assessment nurse, intervention nurse, and recorder to care for the patient. Students engage in high acuity scenarios like those they might encounter in a real-world setting. Our mannequins have complex physiological modeling that mimics true human physiology. All of these capabilities allow our students to engage in realistic scenarios in a safe learning environment. Our maternity room houses our birthing mother and her infant. The birthing mannequin is capable of normal delivery, as well as complications such as postpartum bleeding, eclampsia, and shoulder dystocia. The mannequin provides all of our students the opportunity to witness the delivery during their nursing education, an experience that cannot be guaranteed during clinical rotations on labor and delivery units, but is tested on the nursing licensure exam. Furthermore, faculty are able to provide in-depth instruction about nursing assessment and care of the laboring mother and the baby in utero. Students also learn about immediate postpartum care of the mother and newborn. Our maternity suite is equipped with a fetal monitor and infant warmer to provide a complete, realistic labor experience. Our pediatric suite is home to several high-fidelity mannequins. We have child, infant, and newborn human patient simulators. These mannequins provide our students the opportunity to care for children of various ages, experiencing a wide array of healthcare situations. Students are challenged to calculate and safely administer weight-based medications for pediatric clients, as well as provide nursing care consistent with the child's developmental level, addressing families and other challenges of pediatric nursing. Telehealth is a growing aspect in the healthcare sector, allowing healthcare providers to interact with patients in remote and underserved areas. Our simulation rooms house telehealth carts that allow students to gain experience examining patients in a home or rural clinic setting while consulting with a physician or assessing home health patients remotely. A healthcare provider can also join the student via a teleconferencing robot to make hospital rounds with the simulated patients. Each simulation lab is equipped with a recording system that records and streams video, audio, patient data, and events during simulation scenarios. Students review and perform self-reflection of simulation scenarios during post-scenario debriefing sessions. Throughout every scenario, students apply the knowledge they have acquired throughout their education to the care of the client. Faculty members can allow students to make mistakes without punitive consequences. Faculty members can pause the scenario, talk through the situation with the students, and then ask them to repeat that portion of the scenario. We find these experiences provide valuable learning opportunities for students that translate into heightened awareness and provision of safe patient care. The Capstone College of Nursing is currently undergoing expansion with an additional wing of 32,000 square feet set to open in spring 2021, bringing us much-needed additional classroom, office meeting, and student spaces. This expansion also includes additional floor space and beds for our clinical practice lab and dedicated home health rooms for the simulation center, along with exam and research rooms. We look forward to the opportunities these new learning spaces will bring to our faculty and students. Thank you for visiting the Capstone College of Nursing's Clinical Practice Lab and Simulation Center for Clinical Excellence. The Clinical Practice and Simulation Labs are part of the Capstone College of Nursing's Learning Resource Center, which also includes a computer lab along with technology, equipment, and technical support. The Learning Resource Center provides our faculty with the resources to teach essential nursing concepts and skills and support the college's mission of providing high-quality nursing education through excellence, innovation, and student-centered learning.